Hello viewers, today I am with Dr. Hemant Kaukundla, CT surgeon and Vice Chairman of Century Hospitals. Hello sir.
Hello there.
What is bypass surgery?
See, bypass surgery or coronary artery bypass surgery, or what we call as bypass surgery, is a surgery of the heart vessels. If there are blocks in the arteries which supply blood to the heart, there are three treatments available. Either we can give medication, or if they are suitable, they can put a stent. But if they are not suitable for stents, that is when we will do a bypass surgery. In bypass surgery, the block itself is bypassed by a new vessel. It can either be the left internal mammary artery or the vein from the leg or some other vessel, but we basically bypass the block, so that if there is a block, you bypass it, and that's why this is called as a bypass surgery, so that new blood or fresh blood can go beyond the block and then supply blood to the heart.
When do we recommend bypass surgery?
See, bypass surgery, or for that matter any surgery, is recommended when other options are not available or other options fail. There are three options available for patients with heart blocks. One is medicines, and if the blocks are more than 50 to 60%, just medicines is not enough, and in those scenarios we will have to consider stent. But if the blocks are extensive, or in all the three arteries of the heart, or if the patient has diabetes and other problems in which a stent cannot be placed, in those patients a bypass surgery is far better and actually safer.
What are the symptoms of these patients?
Patients who need bypass surgeries are patients who have angina or chest pain, or some patients who have had a heart attack, or patients who are having an ongoing chest pain, unstable angina as we call it, wherein the muscle is threatened, and if we do not intervene very quickly, there is a possibility that the heart can have a major heart attack.
Are stents not enough for these surgeries?
Very good question. Stents are not always possible in patients who have blocks in the arteries and who need a little more treatment other than just medicine. About 2/3 of them can be treated by stents, but there will be another 1/3 of the patients for whom, for either technical reasons or because previously stents would have been put and they get blocked, or because the blocks are so many that multiple stents cannot be put, then we consider bypass surgery.
Are bypass surgeries safe for patients?
They are. I have been doing bypass surgeries now for last 25 years. The bypass surgery itself has been around for close to 60 years now, and much more popular in the last 20 to 25 years, and they are safe. Normally, we give a risk of about 1 to 2%. That means if we operate and do bypass surgery on 100 patients, there is a risk for 1 to 2 patients. Of course, in high risk patients, it might be slightly high, but these are patients in whom other options are not available, and therefore I do consider that bypass surgeries are safe operations. A lot of scientific research has gone into these operations to make them even more safer now than what they used to be.
How long the patient has to stay in hospital if they go through bypass surgery?
The patients will be in a hospital for about 5 to 6 days, and at the end of 5 to 6 days they will be able to walk around the room, go in the corridor, go to the restrooms themselves, be able to have a quick shower themselves, get into and out of bed themselves, and have a little bit of pain which is not much. So they will be in the hospital for about 5 to 6 days.
What are the risks of bypass surgery?
Again, a very good question, because unless we answer this, we will never be able to convince anybody for this surgery. The risk of this operation can be either a mortality risk, meaning death because of the operation. The risk of that is about 1 to 2%. So if 100 people get operated, one patient or two patients might have this problem. But other than that, the other small complications like bleeding, a brain stroke, renal problems, or prolonged ICU stay because of respiratory problems are risks associated with this operation. But you will have to consider what are the options without the surgery for the patient? The patient will be at risk of another heart attack and possibly death if he doesn't have an operation. So yes, there are some risks for this operation, but not having the operation is a much bigger risk than having the operation with the small antecedent risks.
When can the patient resume to work after the surgery?
See, after the surgery, patient usually goes home after a week or 5 to 7 days in the hospital, and within 2 to 3 weeks they should be able to walk for up to 20 minutes, and then they should be able to go around the house, go up a flight of stairs, be able to look after themselves. If their job is more of a desk job, they can resume work within 3 weeks. But if it is a little more manual work and it involves a lot of traveling or walking, then we normally advise about 4 to 6 weeks rest at home. But after that, they should be able to resume full normal life, including regular work.
Can this be done as minimal access?
Of course, all operations now are being done in a better way, either by a minimal access surgery and even robotic surgery. Minimal access surgery is perfectly possible in cardiac surgery. Many surgeries now, many heart surgeries now can be done as minimal access surgeries, including valve surgeries, including congenital surgeries and coronary artery bypass surgeries. They can be done very safely.
What is beating heart surgery?
See, when we do the operation, traditionally we do the operation by having to stop the heart, and to be able to stop the heart, we have to put the heart onto what is called as the heart-lung machine or the bypass machine, which does the work of the heart and the lungs, so that we can stop both the heart and the lung and do the bypass surgery that way. But of late, over the last 10 to 15 years, there is newer technologies in which you don't really have to stop the heart. The heart can continue to function normally while we do the operation on the heart. So this is called as beating heart surgery, and we have this technology available in most centers now.
Thank you so much for giving your valuable time, sir.
Thank you.
Everybody is failing. So what are the common mistakes that people does while having diet plan?
That's a really good question, because I have a lot of children who come to me who are completely confused.
Yeah, ma'am.
To a certain extent, I would attribute that to the